College London to talk to you. Now, he's cropped up many times, but I first remember speaking to him about this pandemic nearly a year ago when he emailed me out of the blue one Friday afternoon to say that he thought there were hundreds, if not thousands of cases already in Wuhan, when officially there are only about a dozen. His advice, often bleak, is still informing the government, but I promise you, some of this interview is good news. The most important question, of course, is did you get any time off over the Christmas break?
I got Christmas Day off and I got a few hours and a few other days off, but it has been a very busy time.
I've got a couple of questions for you, and my hope is we can get a yes or no answer to these. 2021, will it be better or worse than 2020?
I'm not sure if I can give a yes or no answer. I think it will be very difficult for the next 2 to 3 months and then get gradually easier, depending on how quickly we can roll vaccine out.
Let's tease this all apart. It feels bleak. Day after day, out of more than 50,000 cases confirmed each day, it almost feels like March, April last year.
Yes, and I'm afraid case numbers are going up in every region of the country at the moment. Worse than that, hospital admissions are also going up everywhere.
Is it possible to say how many deaths are already baked into the number of cases so far over the coming weeks? Because we know that where cases come, then hospitalisations follow, and then inevitably some people die after that.
Well, at the moment, I don't see it going down, even if we go into really quite restrictive measures for the next month or two. So we have at least, unfortunately, another 20,000 deaths baked in, almost regardless of what we do, in my view. It will critically depend on how fast we can get vaccination out.
It feels grim.
Yes, we are in the bleak midwinter, which is, I think, a phrase coined on the call with Chris Whitty, but it's a very difficult time.
How much of it's being driven by the new variant?
It would still not have been easy, but a much easier situation had it not been for the new variant. I mean, the new variant, we think, is at least 50% more transmissible. It may be even higher than that. And that really pushes the bounds of our ability to control spread of the virus, even with measures which previously were relatively quite effective. So if we think about the second lockdown in November, which of course wasn't as intensive as the first lockdown back in March of last year, what we see in the data from that kind of second lockdown is areas of the country which didn't have the variants or declining case numbers, quite rapidly declining. But unfortunately, areas like the east of England, Kent, then later London, which had the variant, started to see case numbers go up really quite rapidly, even whilst that second lockdown was in force.
Do you think it's likely the first lockdown, the March-April one, would be able to contain the variant if we were to directly copy and paste the restrictions from then?
Possibly. In the first lockdown, we got down to an R value, a reproduction number of 0.6. So if you add 50% to 0.6, you get up to about 0.9, but even that isn't completely guaranteed because there's a certain minimum level of activity society needs. Key workers need to go to jobs, we need to man hospitals, and all of those things are associated with contacts between people.
That's slightly worrying. Let's just do the quick refresher course for the R number for anybody who's forgotten it in too much mulled wine over Christmas. So that's, for each infected person, that's the number of people they on average pass the virus on to. So if you've got 100 people infected, drop the R to 0.6 and they'll give it to 60 people. So that's quite quick decline. But if the R stays at 0.9, then that 100 people are giving it to 90 people who then pass it on. That's a much slower decline. You're describing a situation where things come down very slowly.
And they may not. I mean, our central estimate for how much more transmissible this new variant is somewhere between about 50 and 80%. So if we're closer to, say, 70%, then even that March lockdown would not achieve R less than 1, would at best flatten the curve, keep numbers at a roughly constant level. And that's frankly why so much emphasis is being put on getting vaccine into people's arms as quickly as possible.
Do we have a choice about schools?
It's a very difficult situation. Nevertheless, I think it's very, very difficult to control spread with schools open, unfortunately.
Why is that? Because there's been so much discussion around children not really being drivers of transmission. Has the evidence around that changed, or is it just that you've got to keep on chipping away at anywhere that there's still contact?
I mean, more the latter. So we've looked quite carefully at, does this new variant target children? And I think the simple answer is no. Everybody infected with this new variant just transmits the virus more easily. That means that whilst you're completely right, schools were not a focus of transmission with the old variants of this virus, with a 50 or even 70% increase in that per person transmissibility, it potentially allows school outbreaks to take off much more readily. And so it's not so much this variant is any different in children than adults, but that overall increase in transmissibility makes control much more difficult and makes schools potentially more of a site for transmission than they were previously.
It really feels like we're pinning everything on vaccines.
Yes, it's critically important we vaccinate people as quickly as possible, and everybody who's offered a vaccine takes up the opportunity.
Neil, challenge my naive assumption that actually vaccines have the potential to change things quite quickly, because COVID affects people disproportionately, age being the biggest risk factor. So you don't have to vaccinate 70% of the UK population to get 70% of the benefit. And we're working down from the highest risk people down to the lowest risk people. So could we see things change quite quickly as people are vaccinated?
So if you keep all the measures in force, then yes, as you vaccinate 50% of the most vulnerable groups, you would hope to see something of the order of 50% reduction in mortality. What we'd like to be able to do as we vaccinate people is to relax measures. And that trade-off is a much more difficult one, because let's consider we vaccinated, say, 60% of people over 65, which hopefully we might get to in the next month or two. There's still then 40% remaining to be vaccinated. If we let transmission take off at that point, you could still see very high levels of mortality in that unvaccinated group. So there will be a very difficult balancing act between vaccinating as many people as possible and then very incrementally relaxing control measures.
How much of this is dependent, though, on exactly how the vaccines work in the real world? Because we know from the trial data that they are preventing severe disease, but we haven't really been able to show from the studies that have been done that they're actually stopping people spreading it. So you might still get infected after you've been vaccinated. You don't get seriously ill, but you could still pass it on. That surely massively changes the picture depending on exactly the impact it has on transmission.
Yes, you're exactly right. And it's one of the large uncertainties around the vaccines now, particularly around the AstraZeneca vaccine, where we have less clear data on whether it protects against infection and therefore transmission. And we're really going to have to monitor as the vaccine is rolled out to answer that question, in my view.
At what point do you think, in time-wise, and I know there's so much uncertainty going into 2021, that we might be able to start thinking about any relaxation? When can I get my life back?
Yes. I mean, I think once we get high levels of vaccine coverage in, for instance, everybody over the age of 60, then that should have a substantial impact on hospitalizations and deaths. And then I think it will just be a matter of really quite cautiously, incrementally relaxing measures and seeing if we retain control of transmission and don't start seeing then a large upsurge in cases and particularly hospitalizations and deaths.
But can we be optimistic for somewhere like spring, early summer, where things weren't too bad last year? In the wake of lockdown, there's a little bit of hope that the weather will help us out as well. And we'll have a decent number of people being vaccinated by then. Can we hope for a pleasant summer?
With a new variant, which is that much more transmissible, yes, we can hope weather will help us, but we'll still be in a more difficult position than we were with the old variant back last May and June. But vaccine will make a difference. So I think it's very difficult to predict exactly how much we'll be able to relax, and it critically depends on how quickly the government is able to roll out vaccination.
Let's just try to make it slightly more tangible. Could we start thinking about, or when might we be able to start thinking about reopening pubs and restaurants or theatres or cinemas?
I'm not going to attempt to make right now predictions about when those measures can happen. Is almost impossible. If we can get 80-90% of people over the age of 50 vaccinated in the next 3 or 4 months, then that's the sort of stage where we can start thinking about really significant relaxation. I think what we'll see is a gradual relaxation from now through probably to the end of the year. Obviously, I very much hope that can happen faster rather than slower, but there will still be restrictions in place, at least through to the autumn, I think.
Now, I know we're so far beyond a crystal ball territory here that it might be a pointless question, but will things potentially need dialing up again next winter? Because if we end up in seasonal virus territory where things naturally find it easier to spread in winter, or if we vaccinate so many people, does that just not become a question?
I think it's an interesting question, the long-term trajectory of this virus. I mean, it will become an endemic disease. It arguably already is. I think the situation will be quite different towards the end of the year.